My name is Marlena Orm. I am a licensed clinical social worker and the director of the Marcel Caregiver Center at Burke Rehabilitation Hospital. When somebody experiences a life-altering illness, surgery, or accident, it affects not only the patient, but their family, friends, and support system. Often loved ones will find themselves in a new role, the role as a caregiver. Being a caregiver can mean different things to different people. What particular words come to mind when you are asked to describe a caregiver? Some might describe caregivers as dedicated, loving, strong, compassionate. I particularly like the word partners. You are the partners in your loved one's care. At Burke, we acknowledge that you might not identify yourself as a caregiver or even be comfortable with the term. But we are here and dedicated to supporting you in this journey. When we talk about caregivers today, we are focusing on informal caregivers, which are friends, family, members of the spiritual or cultural community, as opposed to formal caregivers, which are usually healthcare professionals. You are not alone. About 19% of Americans provide unpaid care to an adult with healthcare or functional needs. This percentage will continue to rise as the population gets older. So why are we here today talking about caregivers? Because at Burke, we see you as an essential member of the team. The team is fully here to educate, prepare, and support not only the patient, but also their caregivers. And we do this in various different ways, through the Caregiver Center, social work, and psychology services, as well as offering family meetings and trainings with the multidisciplinary teams. Now I will discuss some tips that you might find helpful when partnering with the Burke multidisciplinary team. Stay organized. There might be a lot of information shared from multiple providers. Use a notebook or be open to the use of an app to help. Notes taken will be helpful to refer back at a later time, as well as to share that information with outside providers or other caregivers. Learn commonly used language. Learn the language that providers often use in conversations. Caregivers are often asked to help with activities of daily living or instrumental activities of daily living. You might hear the terms ADLs and IADLs often. So what are they? Activities of daily living, or ADLs, are personal care activities that people engage in daily. They include ambulation and transferring, eating, dressing, personal hygiene and grooming, as well as toileting. In today's presentation, we're focusing on bowel and bladder management after a spinal cord injury, so this falls under the category of toileting. Instrumental activities of daily living, or IADLs, are activities related to independent living and include more complex activities, such as transportation and shopping, managing one's finances, meal preparation, house cleaning and home maintenance, and medication management. Another important tip is to tell Burke about your loved one. We want to know who they are as an individual so that we can provide the best personalized care, not only tailored to their needs, but who they are. Tell us, what is important to your loved one? What do they like or dislike? Who are the most important people in their lives? Ask questions. The Burke team is here to help and give you the information that you need. We want to know what you're thinking and what you need clarification with. We want you to feel empowered to do so, including asking questions about what resources are available for me. Discuss your concerns with the multidisciplinary team. Be open with the team about your needs and be honest with them about your barriers to providing care. We encourage you to speak up if you feel that we are asking you to do something that you just aren't able to do. It's okay. We understand that speaking up can be challenging for some people to do. However, we want to know so that we can help guide you in other ways. Educate yourself. The team is here to provide caregivers with the education needed to manage a new diagnosis, illness, or accident. Please let us know if you need us to slow down or if you need some time to process the information that is being shared. This information might be completely new and overwhelming. Ask for help if you need. Take note of what you as the caregiver need help with and who can help you with those tasks. Ask for assistance from family or community. Seek professional help if needed. Accept the help that is being offered from those that you trust. Know the resources and supports that are available in the community. Ask Burke staff for guidance and referrals. Now I'm going to talk about caregiver self-care tips. Connect to others. Seek support and avoid isolation by connecting with your support system and other caregivers. Consider joining a support group. There are various online and in-person groups in the community. Take respite breaks. Caregiving can be challenging at times, so take some time out. Make these breaks manageable and look into professional respite services if long breaks are needed. Give yourself credit and practice self-compassion. Acknowledge all of the things that you are doing. Be kind to yourself. You are doing the best you can. Engage in something pleasurable. Engage in an old hobby or try something new. Do something that makes you happy and fulfilled, or try something that gives you a sense of purpose. Take care of yourself, mentally, physically, emotionally, and spiritually. Caregivers will often neglect their own needs, so be sure to seek your own medical care. Caregivers can be under a lot of stress, and long-term stress can lead to health problems. Know the symptoms of depression and caregiver burnout. So what is caregiver burnout? It's the state of being emotionally, physically, and spiritually exhausted. So some symptoms of caregiver burnout might include social withdrawal from your friends and your family, loss of interest in doing once pleasurable activities, changes in appetite or sleep patterns, getting sick more often, difficulty concentrating, feeling irritable, hopeless, angry, guilty, or overall exhausted, engaging in unhealthy behaviors, or feelings of wanting to hurt yourself or the person whom you're caring for. If you're experiencing any of these, please do seek professional help and support. I also wanted to touch and highlight on some of the positives of caregiving. Caregivers report a sense of purpose, a sense of giving back to their loved ones, personal growth and confidence in gaining and mastering new skills, as well as modeling behaviors for others. Now I'd like to take you for a quick exercise that you can do at any time, anywhere when you're feeling stressed or overwhelmed. Spread your fingers apart and take your other hand and trace with your pointer finger the outline of your hand slowly. Breathe in as you go up the fingers, and when you get to the top, take a pause. Breathe out as you go down the fingers, and just notice how you are feeling. Repeat on the other hand. Caregiving can be demanding and challenging at times. Burke Rehabilitation Hospital acknowledges how important you are and the impact that you have on your loved one's care and recovery. The Marsal Caregiver Center is a beautiful healing environment. Its services are dedicated to promoting the well-being of caregivers like you by providing compassionate support and practical education and assistance. Burke is here for you.